Choosing the right provider for your pregnancy is an important decision. Today we'll be telling you everything you need to know about the differences between midwives and OBGYNs so you can choose the right provider for you. So click those like and subscribe buttons and stay with us. Let's start with similarities for both midwives and OBGYNs. Both of these providers provide prenatal care, labor and delivery care, and contraception or birth control care. They both aim to have the best outcomes for you, the pregnant person, and your baby. Now, you want to trust your instincts when you're choosing a provider, and you want to understand what birth setting you'll be delivering in. You want to make sure that you're visiting different doctors, midwives, and birth centers to ensure that you feel supported and comfortable with your decision. OBGYNs are different from midwives, so here are some of the differences that you need to know. OBGYNs have a 4-year residency on top of medical school that includes obstetrics, gynecology, ultrasonography, oncology, and preventative care. They are certified from the American Board of Obstetrics and Gynecology. They're able to perform surgeries such as C-sections and episiotomies, and they can manage pregnancy complications such as inductions and assisted deliveries. They tend to work in hospitals, clinics, and private practices. Some OBGYNs will specialize in areas like infertility or fetal medicine. They must meet ABOG certification and state certification requirements. And many OBGYNs will also belong to the American College of Obstetrics and Gynecologists, also known as ACOG. One of the most confusing things about hiring a midwife is that there's a whole bunch of different types of them. So they are not a medical doctor, but they often do have a master's degree or an accredited midwifery education. Some of them will be certified through the American College of Nurse Midwives or the North American Registry of Midwives. There are different types. For starters, there's a certified nurse midwife. These are usually advanced practice nurses. They're licensed and they can prescribe birth control. They work in hospitals, birth centers, and do home births. There's direct entry midwives. This includes certified professional midwives and traditional midwives, and they often work in out-of-hospital settings. Certified midwives are similar to certified nurse midwives, but they have less education and recognition in fewer states. Please remember to hit the like and subscribe button so you can get our latest content. There are some other things that you should be aware of when choosing a midwife. Midwives tend to prioritize natural birth processes. This means they're limiting medical interventions unless they're absolutely necessary. They focus on holistic care. This includes education on nutrition, breastfeeding, and infant care. They encourage vaginal births with fewer medical interventions. Now, a midwife can collaborate with an OBGYN if needed. The benefits of using a midwife include reduced infant mortality rates. This means reduced infant death rates. There's also a reduced need for interventions or inductions. Patients tend to report higher satisfaction with the care they receive from a midwife. And finally, there's a reduced risk of preterm births and C-sections when using a midwife. So, how do you decide between an OBGYN or a midwife? So understand, OBGYNs are best for high-risk pregnancies, someone who's going to need a C-section, or someone who has pre-existing medical conditions. There's a lot of peace of mind with knowing that you've established care with an OBGYN in case of an emergency surgery like a C-section. Midwives are best for low-risk pregnancies or people who are seeking holistic, low-intervention care. They're more affordable and often are potentially covered by insurance. Midwives also offer the option for home visits or birth center care. If you are having what's considered a high-risk pregnancy, there are some things that you need to keep in mind. OBGYNs are recommended for high-risk conditions such as gestational diabetes or twins. Now, midwives may be an option as part of the medical team, and they're always able to consult with an OBGYN. It's important to understand a midwife's plan for medical interventions as needed if you're high risk. Vaginal birth after cesarean section, or VBACs, may be possible with midwives depending on hospital policy. Most patients prefer to have a vaginal birth, and both midwives and physicians will support a vaginal birth if it's safe. You want to ask providers about their C-section rates, and you want to make sure the provider's philosophy aligns with your preference. Midwives generally offer more one-on-one support and more hands-on care, especially in low-risk pregnancies. Physicians may be less available during your labor because they might be managing multiple patients. Midwives tend to provide holistic care, including postpartum care, where they offer counseling on nutrition, exercise, and emotional adjustments. This makes midwives uniquely able to provide a higher level of care during a vaginal birth. One of the number one questions people have about their delivery is pain management. In the hospital, both midwives and OBGYNs can provide epidurals. In birth centers or home births, no epidural is available. Midwives will emphasize natural pain management, such as massage, acupuncture, and showers. Hospital monitoring will occur, and so OBGYNs may prefer continuous fetal monitoring and bed rest, while midwives may encourage more mobility like walking the halls and intermittent monitoring. You want to discuss the policies with your birth team in advance regarding all of these things. I hope this video has helped you learn everything you need to know about the differences between midwives and OBGYNs so you can choose the right provider for you. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family, and follow us on Facebook and Instagram for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.